The Doctors' Caucus in the House just met with the two physicians, Republican physicians in the U.S. Senate Tuesday. Dr. John Barrasso from Wyoming and Dr. Tom Coburn from Oklahoma. Dr. Coburn told us that he thought there may be 18 Republicans in the Senate that would vote for a Baucus bill. Just last night, I had a fundraiser before I came down here, and our U.S. Senator Johnny Isakson came as my special guest to help me raise money for my reelection. And during the question and answer period, he was telling us what was going on. Actually, the Finance Committee was meeting into the evening last night while we were doing this fundraiser. And they were doing what's been called a markup, but actually the Senate doesn't even have a bill yet. They're just talking about principles. They don't even have legislative language in the Senate. And during the question and answer period, he said probably in the Senate bill, when it's written, they're going to send it to the floor. Senator Snowe is, from Maine is going to put in her public option trigger. And really that's just a smokescreen so that folks could not vote for a public option, but vote for a trigger which will put it in place anyway. And Senator Snowe said she would vote for the Baucus bill if that's put in place. So we'll see how that plays out in the next week or two over on the Senate side. On our side, Nancy Pelosi is going to take the three bills, which are slightly different. The three committees looked at the H.R. 3200 and did the amendment process, and so they're a little bit different. She says that she's going to pull those together, have one bill that she says is going to be on the floor within 2 weeks. When we left last night, Steny Hoyer, the majority leader of the Democrats, said that we would not see a bill in the House in the next 2 weeks. But the president wants to have a bill on his desk by the end of this year. Nancy Pelosi has said just this week that she wants to pass a bill out of the House by Thanksgiving. The point of all this is we don't have any time to waste. And I want to enlist your help in an army of grassroots activists all over this country that says no to Obamacare. And the only way we're going to do this is if you get actively engaged in the process by contacting your patients, everybody within your sphere of influence. We don't have much time. The future of healthcare in America depends upon you. But if you will get engaged, if you will do what I'm asking you to do and volunteer for this grassroots grass fire of support against Obamacare and some good market-based solutions to health care, we can change the health care financing in this country. But I need your help. And it's only by you, and I gave the message yesterday to the Million Med March. I gave the same message back in September, on September 10th, when several of you were in Washington. I give it to the Electric Membership Corporation folks. I give it to the bankers. I give it to everybody that I can who are freedom-loving Americans. Right now today, and let me just give you a little bit of news about the environment in Washington. There are two, in my opinion, there are only two members of the U.S. House of Representatives that believe in the Constitution as it was originally intended by our founding fathers. It's me and Dr. Ron Paul. I'm asked frequently how many conservatives are there in the U.S. House. We have 178 Republicans today. When I joined the House in the 110th Congress, we had 202. And the number that I give when I'm asked that question has really not changed. It's very difficult to give a set number because the votes are different on different issues. But right now today, as it was in the 110th, it's somewhere between 30 to 50. 30 to 50 out of 435. That's the reason it's so important for you not to write a $25 check, but a $2,400 check to candidates for both the primary and the general election if you can afford to do so, because that's the maximum that you can give. But give whatever you can. Support the association's political action committee so that they can go out and give money to physicians and others. Some of you may be thinking, being called to run for office yourself. And it's important for us that are engaged in healthcare, who do understand that, to run for office on the local level, state level, as well as the federal level. Let me tell you, being a member of Congress is not a great lifestyle. In fact, it's the pits. I really enjoyed practicing medicine a whole lot better. I still practice medicine. I even had to get permission from the ethics committee, from Nancy Pelosi's folks, to be able to just see my own patients. And they said I cannot make any money whatsoever when I do so. I can charge, but only to cover my expenses. The hassles of keeping that accounting was just too much for me to even think about. So I decided to do what I've said for my whole medical career that I'd like to do, and that's see patients for free. But if we're going to defeat Obamacare, if we're going to be able to make decisions within that relationship of doctor and patient, it's up to you. It's not up to us as Republicans in Congress today. It's not up to us even with the Blue Dog Democrats. It's up to you. It's up to your patients and everybody in your sphere of influence. So think about Amway. Help us who are fighting for market-based, private enterprise type solutions. Help us by lighting those grass fires in your community and all over this country. And we can save quality health care in America, and we can continue to practice medicine without the government intrusion. Do I have time for questions?